Hello all. Welcome to the session which is I've been going to conduct right now is on skin and structure decoding section of A of Jhar's repertory. So today we are going to discuss a few points and few section from Jhar's repertory. So I welcome you all to this session, those who have joined and those who have registered as well. Thank you for this session. So we'll go into the session very deeply, understanding of different remedies, and there, especially this Jhar repertory is concentrated on the skin eruptions, skin symptoms, and the remedies as well. So here I am going to discuss the remedies in brief, like when to give, when not to be given. There are many remedies under some rubrics, right? We have confusion when to be given this remedy. So I will be discussing you some of the confirmatory symptoms, some of the key points when to give, when not to give this remedy, especially in the skin of the section A. So before understanding of Jhar's repertory, we'll go a quick about Jhar. Who is this man behind this? So George Henry Goddard Jhar was one of the earliest and most influential repertory compilers in classical homeopathy. So he was Jhar sir is a very close associate of Samuel Hahnemann and played a major role in organizing homeopathic materiamedica and repertory literature into practical clinical format. So Jhar helped transformed or scattered materiamedical information into usable repertorial structure. Before systematic repertories become common, physicians struggle to locate remedia quickly. So, Jhar arranged symptoms anatomically and clinically, making remedy selection easier in daily practice. So now we have very so much of softwares of computer system or phone Android system repertories. At that time, there is no such softwares, right? So Jhar made easy of searching or quick search, especially he arranged almost in anatomically and in a clinical way, so that we can get remedy selection very easier in daily practice. So his work become a bridge between Hahnemannian Pura Medica. So that's why when you read any Jhar's book, there is one book of 40 years experience from Jhar as well. So there is so much of belief or there is so much of reliance in his books. Whatever he mentions it is very verified clinically with the experience of 40 years he has been done in homeopathy. So these literature or whatever he give the remedies under certain conditions are so much reliable and we can justify with the patients as well. So later repertories like those of Constant Hearing, Boningusen and James Taylor Kent. So what is the difference between Jhar and Kent here? Jhar is more of clinical and regional. So it is like Nash Metromedica. Like for example, if you go to read Nash Metromedica, he generally divides into organopathic remedies or trios of remedies like digestive system, Naxomica, like Pulsatilla, Bryonia. So he has divided it. So the same in Jhar, but Jhar is in a repertorial way, very clinical and very regional. And even if you read his books also, it will be like in headaches he will giving n number of remedies, in skin or in abscess he will giving n number of remedies with the experience he had got through the remedies with cases as well. And more of objective symptoms in Jahars, you will be focusing on objective symptoms. What Boger, synoptic Boger or CM Boger has been more on objective symptoms. But coming into the Kent, very philosophical and general. Mental generals are more emphasized in Kent that we know generally. And Jahar is more of anatomical arrangement, you can see here. This is of Kent is hierarchical repertory. And practical bedside use is Jahar's repertory. And Kent, it's more of constitutional analysis. And what are the contributions of Jhar has been done for homeopathy? One is Manual of Homeopathic Medicine, 40 years of clinical practice experience book which was written by Jhar, and New Manual of Homeopathic Practice, Repertory to the more characteristic symptoms. These are the some contributions about Jhar. So before entering into the our skin decoding of Jhar's repertory, I am going to tell you that we are going to conduct a constitutional approach of skin diseases with real case history. And in this webinar, we are going to discuss 4 cases of real cases from my clinic with patient testimonies and before after, only especially of skin diseases like psoriasis. We have 4 cases of beautiful psoriasis results, and that has been done because of Jhar's repertory usage and some other repertories. But Jhar's skin, this repertory has been wonderfully used in these 4 clinical cases very beautifully, and their application I am going to discuss in this upcoming session. 4 cases and 4 remedies. Of the cases, we are going to discuss the remedy in depth, in detail of the remedy, like from the constitutional, from the clinical approach, from clinical insights, how a patient behaves, how he walks, how what the gestures he make during case taking, what patient speaks, how he speaks. So everything we are going to discuss these 4 remedies and 4 cases with rubric repertorial and non-repertorial approach. So here you see many people go into understanding of repertorization first, but before that you need to understand the patient look, why I have confirmed this remedy, why I have conclusion to that remedy, that we can go through only the objective symptoms or go through the way patient speaking and the approach, the eyes, the hair, the neck pattern, the hands pattern, the tongue, even the tongue will tell you the constitutional. So these 4 beautiful cases were cracked by me with LM potencies, beautiful results, and we'll be sharing this as well in our coming webinars. And this session is going to be on 30 June. Recordings will be provided as well. For registrations, you can contact this number. And fees is very minimal fee, just 199. You will be getting, and 2-3 months of recording will be available to you. For more details, you can contact this number for the registration. And if you have any doubts or anything, you can just take a screenshot of this. This is our WhatsApp group and this is our YouTube channel. You can go through our previous videos like art of understanding materiamedica, art of case taking, and we have done clinical experience of Kopikar sir's 70 years of Kopikar sir experience webinars in our group. And we have done some beautiful remedy explanation like staphysagria, picric acid, naxomica. Very in-depth understanding of each remedy is discussed in our YouTube channel that is posted there. And for your doubts and for daily clinical tips, you can join our WhatsApp group, and please take a screenshot and you can send to someone who have been interested in this. Right, coming to our session here, all these rubrics and all these remedies were picked from section A of Jhar's repertory. So keep this in mind. We are going to discuss only few remedies with understanding of the clinical application of these remedies. Am I good? Am I audible or am I going fast? Shall I start and continue? Please do text. Yes, thank you. See today, this is the first slide from Jhar's repertory. See this, epigastric and upper regions, that is pit of the stomach and liver. So especially in these cases, yes, especially in these cases where the spots are inflamed. See, many people come with skin eruptions, any spot involved, any rashes, anything. That region they said, doctor, now here I am getting pain. Now we generally think of modalities. Like for example, if you get any skin eruption and he shows that especially on the chest region or in the stomach region, he is getting some spots. So you generally ask when the itching is more, when it is less. Then the patient say aggravated at night. So if there is aggravation at night, we generally go into the conclusion that it is sulfur or it is syphilinum. If there is itching and burning, then again sulfur and syphilinum, right? This is the approach generally we do as a beginner's mistake. And I also did the same. But here we are not going to concern only modalities, especially in the skin eruptions or skin cases. Try to understand the location behind it. For example, here you see the spot inflamed. If the spots are inflamed, especially in the spots, we can think of arsenic. With spots inflamed, arsenic has a lot of burning, lot of fastidiousness, and lot of insecurity and anxiety for health. These this picture you need to match. Here you are not going to focus on one single symptom. If you are going to focus on one single symptom, your result never appears. Please keep in mind, try to combine everything, try to see at least three different angles of each remedy from each patient. If you are confirming arsenic, try to confirm fastidious, try to confirm anxiety of health, try to confirm fear of health. Arsenic worse from cold drinks, hypochondriacal patient, a lot of burning, insecurity. And I will tell you one beautiful clinical tip for arsenic to prescribe. If he is 100% arsenic, there will be cracks in the soles. This is the key confirmatory for arsenic. If you see cracks in the soles matching to arsenic, blindly give arsenic, it does wonders. And from Kent's repertory, single remedy, soles cracked is arsenic. The same with belladonna, a lot of congestion you can see there, and headaches. And belladonna desires for lemonade drinks. That is a key confirmatory from the physical point of view. Cantharis, we all know, a lot of burning sensation in the urination, or burning is more prominent in Cantharis. And Cantharis is a wonderful remedy for hair fall. Right? We generally think of many remedies for hair fall like phosphoric acid, thallium met, mancinella, some other remedies like nitramur, even nitramur as well. But Cantharis is also very equally to thallium metallicum. Cantharis, remember this. So like this, laches is more of jealous, you need to find out. The tongue is more of widen and fear of snakes or dreams of snakes, locacity of laches, that you need to find. Leadum pole, ascending pains, and the part is cold. Lycopodium we all know, and arsenic lycopodium comes very close, very close. Nitramure, tongue cracked. So these confirmatory symptoms, you need to match the patient, not just prescribing on single symptom or not just prescribing on single spot inflamed, use this remedy. It doesn't work. So here you need to match the objective symptoms, you need to match the confirmatory symptoms, you need to match the constitution of the patient. So that's why here you see pit of the stomach with lot of spots, that is nitramure. If this is the stomach region, see this. If a patient said, doctor, here in the pit of the stomach there is lot of spots inflamed, that is objective symptom patient is showing you. So you need to think of this remedy, nitramure. Hepatic liver region rash, especially in the hepatic and liver region rash, selenium is a wonderful remedy. Selenium, and selenium is a wonderful remedy for impotency, especially of old age peoples. Old age people. Now coming into the umbilical or navel region. If there is structural changes in hernia, especially in umbilical or navel regions, think of these three remedies, that is causticum, lycopodium, and lachesis. Right? And causticum, how to confirm a causticum patient? Very cared, worried for others, especially even if he having a lot of suffering. First he will tell, see my daughter, see my son, or see my grandchildren, they are suffering. First they are men, then after I will check doctor. That is the key confirmatory for causticum. Cared, worried for others, very sympathetic remedy like phosphorus, like nitric acid. And especially in almost all the causticums, they are aversion to sweets. Causticum patients are aversion to sweets, and injustice cannot tolerate. Injustice cannot tolerate. And causticum patients have history of paralysis or family history of paralysis, that you need to confirm with the patient. Right? Lycopodium is a huge polycrust, we all know. But lycopodium, remember, as I said, arsenic is cracked in the soles, right? Lycopodium crack in the heels. If you, I almost all in my clinical experience, I have seen around hundreds of lycopodium patients. Almost all out of 190 patients having crack in the heels. That is a key confirmatory for lycopodium. Heel cracked is lycopodium. Along with that, you need to match the constitution of lycopodium. So that is what we are going to discuss in our coming webinars, how the four remedies very beautifully constitutional approach. And lycopodium, I'll tell you one of the key confirmatory, they always desires for warm food, warm sweets, the key confirmatory of lycopodium. Lachesis, I already discussed. Lesions, pathological ulcers is arsenic with burning. Arsenic, if arsenic is there, you are prescribing arsenic, confirm with burning, confirm with burning. Vesicular and linear changes in the streaks of umbilical region, it is phosphoric acid. So phosphorus and acid both combine, right? There is a lot of weakness, debility, loss of vital fluids. Phosphoric acid is a wonderful remedy for mental and physical exertion if it is indicated. It is indicated. And almost all the phosphoric acid patients desires for juicy things. They almost likes juicy things, right? Coming into some sensory experiences, especially in the umbilical region, with lot of itching, ignitia, kali hydrogen, magnure, oleander, phosphorus, pulsatilla. Pain as if ulcerated. If there is ulceration of pain, especially in umbilical region, think of macab. Macab is a wonderful remedy in materiamedica, which is called orphan age of materiamedica. Coming into inguinal and lymphatic and pelvic region. Inguinal, both glandular and non-glandular. So if you are thinking of glandular remedies, almost all glandular remedies like kali iodatum, hypertrophy, phytolacca, all these are glandular remedies. Conium is wonderful glandular remedy. That thing you need to understand when to apply, where to apply those remedies. So inguinal, lymphatic and pelvic region glandular, sensation of swelling, especially in early stages. I said, right? If you are thinking of any glandular remedy and you are not at all getting the to prescribe remedy, you are confused between few remedies, immediately think of remedy conium, right? And silicea. Inflammation and affection parts, graphitis, silicea, aurum, arsenic, and calcarea carb. So there is a lot of inflammation in the remedies. Graphitis with inflammation, you need to have any pussy discharge that is like honey like discharge. Silicea also same. Aurum is also very close with that. Carbovage with lot of cold sweating you can think. Climatrix, especially a full moon and new moon aggravations there. Dull camera, especially worse from the change in the weather conditions, you can think of there is inflammation of dull camera, right? Merck with lot of offensiveness and a psychotic remedy. Nitric acid, phosphorus, stanamet, stramonium, staph, sulfur, terbinthana, and thuja. I'll tell you, I had a wonderful case that is actually it is colon ulcer, colitis. Patient is complaining of colitis with severe pain. The reports were sent for biopsy, but still I did not receive. Maybe I'm suspecting the cancer, but colitis pain, ulcerative colitis. I have started with terbinthena olum very frequently. Within 1 hour, 2 hours, patient has remarkably improved in the pain. Terbinthine alum is a wonderful remedy for colitis, especially mucous membrane affections. We generally think of this remedy for kidney, right? It has wonderful action in the kidneys, and it's the same. It is a beautiful action, especially in colitis, ulceration of the colitis there. Terbinthine olum. Remember this. Try to read from Phatak Metra. Inflammation with swelling. Agaricus, antimonium crudum, croton, graphitis, hepar and theridion. Red swelling of glands. If glands are swelling and the appearance is red, think of these two remedies: lycopodium, Merksol, syphilitic remedy, Merksol, with lot of offensive and lot of salivation you can see in this remedy, especially of lot of suppurations, aurum, Merk, nitric acid, and sulfur. If there is ulceration of glands, if there is lot of ulceration in the glands, you can think of Heparsulf. Local inguinal tissues, that is non-glandular. Now we have discussed about glandular. Now if there is non-glandular inflammations with lot of soreness, if you see soreness, rawness, we generally think of arnica, right? The same equal grade is bryonia, calcarea, china, spigelia. But in the inguinal region, try to understand the location. So location is most important. Many patients, many acute cases, patient come with exact location that we are missing. Generally, we say there is a lot of soreness, doctor. Give arsenic or give arnica. Sorry, maybe it will give the relief, but you need to target the location exactly to get a complete relief from the patient, especially in acute cases. Managing acutes is a wonderful in homeopathy, wonderful. And lot of pustules in inguinal region is pulsatilla. Ulcers in the fold of groin region, Groin region folds with lot of ulcers. You can think of beretamure and Feparsulf. You can take a screenshot of this. Once you are done with screenshot, please do text so that I will change the slide. So these are the imaginations which we have prepared with our teamwork as well. See, if there is burning sensation, especially in the umbilical region hernia site, causticum lyco, with ulcer is arsenic, with stroke streaks. These appearances you need to find out. If you whenever you get these cases, try to examine the patient, try to touch the patient, try to see. Then your remedy works wonders. With a lot of glandular swellings, see the remedies. Syphilis, graphitis, in inclinated hernia, and tabacum is a wonderful remedy in strangulated hernia. In strangulated hernia. Shall I go with the next slide? Did you take the screenshot of this? Shall I move to the next slide? Please do text. Next. Vascular alteration and color changes. So here you see color changes. See why I concentrated especially on the location parts. See the locations, glandular, non-glandular, and the structural, the sensory experiences, the spots. Because my intention here is to understand as a whole, not by one single symptom, right? Even the vascular alterations, even the appearance of the skin will change the remedy. Skin will change the remedy. That you need to understand. That's why many homeopaths, along with me, we generally fail because we generally don't examine the patient, or we generally don't take the case very deeply, or we generally don't observe the skin appearances, or we generally don't appear the location, or we generally don't see objective symptoms. This is where we are lacking of. This is where we are lacking in the knowledge. This is where our remedy is not at all conforming exactly and not at all working. On this we need to work on. And these we need to work on, especially in psoriasis cases, especially eczema cases. In my clinic, I have around 15 to 20 psoriasis cases are getting better, and almost all the cases have been done. They have beautifully improved with LM potencies, some with LM, some with 1M, some with 200 as well. Now, why I have given LM, why have I given 200, why have I given 30? I will be explaining this very clearly in coming sessions. It's beautiful art, and that you need to understand. See, we as a homeopath should crack the cases which is of documentary, which we can show to other doctors or other modern schools that we can do it. That is the only skill. In that cases we can show. I have wonderful cases, very severe chronic cases has been cured from my clinic. Black and blue swellings with lot of ecchymosis, accusa and vipera. And you tell me, in almost all vascular alterations, you can think of snake remedies. Works wonders. See this, vipera is also a snake remedy, right? Lacasis is also a snake remedy. Again here vipera. Again here vipera. These snake remedies works wonders, especially in vascular alterations, especially venous alterations, the pathology of veins. This remedy works wonders. Snake remedies works wonders. Why? Snake poison is injected into the vessels, right? That is the action. So Botropos is a wonderful remedy for varicose veins. But you need to have the indication, either it is blue or either it's black, how the appearances. That is main thing. Black and blue swelling, accusa and vipera, lot of blackness with lot of gangrene and septic conditions. Think of aconite and vipera. And if these remedies are going to fail, especially in gangrenous states, especially with lot of blackness, think of wonderful remedy, that is gunpowder. Gunpowder is a modern medicine and a modern wonderful medicine above heparsulf, above silesia, above arsenic, above terentiloquens. Gunpowder works wonders if it is blackish with lot of gangrenous, with lot of septic. beautifully. Give gunpowder very frequently in 6C or 30C. Works wonders. Scarlet with lot of redness, belladonna and rustox. Red skin, red spots, ammoniacum, graphitis, rustox, belladonna, lachesis, and sabadilla. Right. Generally, we think of sabadilla for hay fever, allergic rhinitis. Right. It's a wonderful remedy if you have any red skin, red spots. Is sabadilla with lot of delusion that my body is make like delusion like baking soda. There is wonderful rubric single remedy sabadilla there. Brownish spots, lot of brownish spots is sepia. That's why you can see almost all sepia patients, they will have this butterfly like eruptions, especially brown on the cheeks. There's a key confirmatory for sepia. That is the key confirmatory for sepia. Generally we call it as melasma or chellosma, right? Yellow spots, cantharis and phosphorus. You can take the screenshot here. This is the image picture which we have done for you all to concentrate the location, the appearance. That is what Boger has more concentrated on. LSMC, location, sensation, modality, concomitance. Here we are concentrating on location, the sensation, and the appearance of the part. Right? Screenshot is done. Shall I go to the next slide? Shall I move on to the next slide? Thank you. Coming to the eruptions and open lesions. Open lesions, vessels, vesicles fluid filled. If it is fluid filled, think of causticum and Merxol. Think of causticum and Merxol. Pimples, open lesions, arsenic, baratamur, bryonia, chamomilla, dalcamara, nitrum mure, and petroleum. Right. Generally, in pimples, we think of so many remedies. Right. These are some remedies you need to understand with open lesions. I'll tell you one beautiful clinical tip, especially for acne or the pimples on the face. This remedy has given wonderful results for me. That is Lapa articum. Lapa articum, but in Materiamedica it is written Lapa articum and Lapa major. Lapa major. It's a wonderful remedy for acne cases. And if it is acne with lot of pain, Kali bromatum. Kali bromatum. It works wonders. And pimples, acne with lot of pus discharge, hepar sulfur silicea. Hepar and silicea. Pimples with lot of reddish appearances, you can think of medorinum, but you need to confirm it because it is a nosode. Before giving any nosode, at least you need to have the matching symptoms of the patient. Fork shaped pustules is pulsatilla. Ulcers, arsenic, baratamur, china, coppermint, hepar, and plumbum. Boils, phosphorus and zincum oxalic acid. Boils, abscess, carbuncles, right? We have n number of remedies, n number of remedies. I'll tell you a few remedies like in boils, abscess, like hepar and silicea. We generally think of these remedies. And if hepar and silicea is failed, then you can think of the other remedy, Myristica sebifera. Try to read from Boric, I think first paragraph, last line. It has written, like Boric has written, it is more powerful than hepar sulfur and silicea, Myristica sebifera. If that is failed, you can think of gunpowder, you can think of arsenic, you can think of anthracinum, you can think of streptococcinum, staphylococcinem as well. But the indication is mandatory before entering into the each remedy. That is what the main we are missing. I'm going to discuss the indications very, very clearly for each remedy. In almost all tumors, nitrum remedies works. Erysipelas, graphitis, red rashes, selenium, general eruptions, belladonna, bryonia, and Merxol. Inflamed spots that we have discussed, arsenic, belladonna, cantharis. These all the inflamed spots are the common remedies there. Especially in head region, head, scalp and general, there you can think of calcarea and lycopodium. In eyes with lesions of eruptions, bryonia, nitrum mure, pulsatilla, and stanamet. Stanamide is a wonderful remedy for respiratory problem, especially for the cough, continuous cough. Patients say after coughing, I am getting lot of chest pain. Even while talking, I cannot able to talk. Stanum 30 or 60 frequent repetition does wonders. Does wonders. It's a beautiful remedy for respiratory action. Coming into the oropharyngeal region, tonsils, pretonsillar or abscess. There are n number of remedies. Right? Bereteca, belladonna, beriberi, granatum, which is extracted from pomegranate, ignitia, lachesis, myrrh, naxomica, sepia, hepar, and sulfur. Right, but I'll tell you beautiful. So in especially in tonsils cases, try to examine through the torch how the appearance is. If there is lot of reddish, either it is right or left. If it is right, you can think of the remedy Merck iod rubor. If it is left, Merck iod feller. And tonsils are alternating sides, one day left, one day right. It is lac caninum. And tonsils cannot swallow liquids is lachesis. Tonsils with lot of burning, and the pain is extending into the ear, phytoleca. So this is n number of remedies for these tonsils, but here according to Jhar, he has mentioned these remedies, but you need to differentiate there. Right, I'll tell you beautifully. For example, you got a case, and patient having lot of joint pains. Maybe he has diagnosed with RA or polyarthritis, and you are into the history of past history, and patient tell doctor, I have past history of tonsillitis. Then the remedy is guacam officinalis. Past history with tonsillitis, and now patient is complaining of polyarthritis or joint pain, rheumatic pains. Think of the remedy guacam officinalis and staphylococcus. Beautiful remedies, beautiful. This is why past history is also wonderfully important in selecting the remedy. Gums, dental, abscess, ammonium mure, cantharis, causticum, sulfur. Tongue is nitromure. Why nitromure? See, in almost all mouth ulcers, mouth problem, burning, any boils in the mouth, any boils on the tongue, nitromure is the best remedy. Nitromure is the best remedy. Nitromure is the best remedy. Is it audible? Is it audible? Actually, power has been shut down. Is my voice is audible, right? Is it clear? Is my voice is audible? I am back. Is my voice is audible? Is it clear from my side? Please do text so that I will restart again. Is it clear, audible, and screen is visible to you all? Yes, yes, it's clear. Is my PPT is visible? Voice is clear. Slides are moving. Slides are moving. Yes, thank you. Right, we are here. Coming to the next location, that is cervical and dorsal region. Cervical and dorsal region, especially in the neck, nape of neck, it is cilicia. Neck with general and cervical, it is hyosamus. Axillary abscess is petroleum. Back of general drosum, if you have lot of eruptions or abscess, it is lachesis. Especially loans in lumbar abscess, you can think of cilicia and staphysagria. Here it is the anatomical map for you all. You can take screenshot of this. This is the anatomical map and abscess. Almost all the abscess, especially with the location actually. Shall I go to the next slide? Screenshot is done. Yes. I will let you know. Please wait for a while. Yes. Next, aching and pressing pains, especially in this aching and pressing pains, blood vessels with lot of swelling. You can think of ignitia and phosphorus with lot of pimples, especially swelling and aching regions here. And right, moscus, noxomica, phosphorus, camphire, carbovage. But in camphire and in carbovage, the ulcers will be cold to touch, and the body is so much cold. China, graphitis, and silicia. Cons, you can think of anacardium, antimonium crudum, bryonia, calcarea, causticum, graphitis, ignitia, LICO, magnum acetatum, magnus astrus, phosphorus, phosphoric acid, sepia, silicia, staph, and sulfur. But here, please remember that at least you need to have few indications of each remedy to prescribe. Right? Dorsal region eruptions, murk. Dorsal region swelling is murk. Lower limb eruptions is kali. Almost all kali families have these lower limb eruptions. Acne in general acne, digitalis, drosera, graphitis, nitric acid, sabadilla, sabina, and sulfur. Especially nose part acne, drosera, graphitis, selenium, and sulfur. Face acne, digitalis, drosera, nitric acid, sabina, selenium, and sulfur. So here you see acne in general, nose, face, in almost all these rubrics. Jhar has mentioned digitalis, drosera, and sulfur in almost all the three rubrics. So these remedies are wonderfully useful, especially in skin pathology. Try to refer from Fatak. Fatak sir has mentioned few indications about it, and you can refer Clerk's Materiamedica for this. And here is the map. You can take the screenshot as well. Homeopathic remedies by area and application, face, nose, and in general. In general. So generally pimples means we think of beriberi aquafolium, right? But I never got results with that remedy, either locally or either internally. But if it is indicated, it will work. Acne shaped pimples are seen, like belladonna, carbovage, hepar, silicia, and sulfur. Head eruptions in is bovista. Bovista have lot of head eruptions. Face blisters in belladonna, carbovage, hepar, and silicia. Also acne rosacea, acne punctata, and acne nigricans. This remedy works wonders. Pimples of the anal region are found in antimonium, ars, and antimonium tart, pustules in dull camera and thuja. And you know, dull camera is a wonderful remedy for skin pathology. Please refer from Boric and Fatak. It is a wonderful remedy, especially skin eruptions, warts on the hands, warts on the fingers, warts on the palms as well. It works wonders. Del Camera. Adhesions of the skin is seen generally in arnica and Paris quadrifolia. Sensation of adhesions in caries in arnica, asafoetida, aurum, china, helleborus, merc, phosphoric acid, pulsatilla, ruta, sabina. Adhesion is nothing but the combination there. If there is any adhesion on the skin, my voice is clear, right? Yes, yes. Actually, I lost the signal, and we are actually end of the chapter. We are actually end of the webinar. There is only one slide which is there, and we'll be sharing you through email or in the WhatsApp groups. And this session will be uploaded in the YouTube by adding at the last end of the slides with explanation. And sorry for the interruption. Only one slide is remaining. Only one slide is remaining. Almost all I have completed the whole webinar. The one slide which I have missed, I will be adding in the YouTube along with the explanation. And thank you all for joining this session. Thank you all. This session will be uploaded in the YouTube. Please do share your feedback and please do join our webinar as well, which I am going to be conducted very soon. Join this and enhance your skin cases very beautifully with constitutional remedies. Please do share your feedbacks to my number. If you have in a WhatsApp group, you can share me personally, and you can scan our group as well. Thank you so much.